Hello, my name is Steve LeCroy. I'm the Director of Clinical Support for Mercury Medical. I'm a 35-year paramedic and about a 40-year respiratory therapist, and I wanted to go over today the small adult, what we call a CPR-2 CPR bag or bag valve mask. Now I have it here in front of me. As you can see, it comes in a poly bag like most CPR bags or BVMs do. I'm going to take out and go over some of the different parts and some of the benefits and features of this particular product. As with all BVMs, it comes with a mask. There are different size masks that can be added to it, because you're going to find with this particular BVM you can not only do adult patients, you can also use it on children. So an expanded population for same size bag. So the bag comes out of the poly bag in a folded position. The easiest way to expand that is to kind of put your finger over the end where the mask would go, and then just kind of squeeze the bag and it pops out, and then you got your standard bag. Now you'll notice the bag is smaller than maybe what you're used to. This is a 1000 cc bag instead of a typical 1500, maybe 1600 cc bag. Now this particular configuration of a BVM comes with different necessities, as I call them. Some people may call them accessories, but I believe that these products or these components are necessities. So I wanted to start at the top here. Is we have a Peep valve. Peep valves are becoming standard in a lot of places when you're doing manual ventilation. The Peep valve will come in the 0 position. That's a safety feature, so there will not be any PEEP being applied as it comes out of the bag. To make the adjustment, you twist the blue top knob at the bottom and towards the bottom, and you're screwing it down, and there are numbers on the side that tell you what you have, and you can also verify that on your manometer. So we have a Peep valve. If you decide to use a filter, there's 2 places to put a filter. This is the first place that I'll show you. You can actually put it in between the Peep valve and the patient valve. So it would just go on here, so you would have it in between. And I'll show you the other location momentarily. Other benefits for this particular bag: it does have a manometer. It's really kind of important, and in some places it's actually required to measure inspiratory pressure. We know that if you start getting above 20, we can run into some issues, but you're going to find that there'll be times that you'll have to use higher pressures, typically with a near drowning CHF or an obese patient will take more pressure to actually get chest rise, but it's good to document what that is, so it's a feature that's helpful there. Also attached to the manometer, you'll see a little red tag. If you pull that tag, it's going to cause a light to flash. There you go. It's going to flash every 6 seconds. The idea is to give you your rate. That'd be 10 a minute, obviously. It's appropriate to be done in that fashion when you've got an advanced airway in place, such as an ET tube, a supraglottic airway, a laryngeal tube. So for advanced airway placement, this gives you the rate. So we're trying to add the PEEP, we're trying to give you some feedback on the pressure, and we're giving you a flashing light to help as a reminder of when to squeeze the bag. You'll also notice on this bag that there is a pressure pop-off, which isn't often found on an adult bag. You always see them on infant and most children's bags, but not in adults. This was placed on there so that you can actually use it on a child. So you got one bag that will fit, like I said earlier, a wider range of population. The clip can override it. You can put, and then of course you have unlimited pressure when you do that. It's going to come in the off position. The clip will not be on. That's a safety feature, because this is going to pop off at about 40 centimeters of water. So if you need more pressure than that to get chest rise or a good expansion, then you would have to put the clip on. Now, as far as where a filter can go, their filter can also go between the mask and the patient valve, if that's a location that you would want to use. So remember, it can be between the Peep valve and the patient valve, and it can, or it can be between the mask and the valve. Another unique benefit of this particular configuration and you can maybe be able to see it on the screen a little bit. There are volume markings. Volume markings have been an issue, or determining volume has been an issue for a while to try to prevent volume trauma or overstretch. So we have these volume markings on here for 200, 300, and 400. Now it takes a little bit of a modification to be able to do this, is that you want to, once you've determined the volume that you would like to have, say we're going to go for an adult, this is going to be around the 400 range. I'm going to put my thumb on the 400 and I'm going to put my middle finger on the opposite side where there's a 400. You'll notice I'm not wrapping my fingers as maybe I've done in the past, and I'm basically bringing those two fingers together. That's going to get you in the range of 400. Now, to help with this, one of the things we want to do, because people say, well, how high do I want to go? How do I know how close I am? Is that to properly ventilate a patient is between the two fingers, but I'm also watching chest rise. That hasn't changed. So as soon as I start to get chest rise, then I need to stop squeezing the bag. That's going to put me in the ballpark for closer to the standard that's out there, which is that 5 to 7 mLs per kilogram. So also comes with a bag reservoir, as most bags do come with either a tubing or come with a bag. And you have your oxygen tubing, which has got a universal connector. It can either be screwed on or it can go on to a nipple connection. So that's pretty much the features and benefits of this particular configuration of Mercury Medical's CPR-2. Have a good day. Thanks.